Awesome. Ready for the next clip?
Let's do it.
Brings you in today?
Friend made me come in. Name's Robbie. He said I should.
Ah, you're Duke. Donnie. Robbie's VIP is here.
Hi, I'm Don, nurse practitioner. Robbie's already put in orders for a numbing spray for your nostril.
Nostril, it's my throat. It's not my nose.
Okay, let's get you set up in the room.
Yeah, so a pretty short clip, but I did it because it talked about like VIP. So this is a friend of Robbie's who's like is a mechanic, someone he knows, has a good relationship with, seems like, and he has this person come in on a very hectic and busy day, and you see this patient come right in, and he's taken directly to the back and called like a VIP. So a VIP, like basically in a medical sense, not just like a celebrity or a famous person. A VIP can be like a hospital administrator. It could be another physician, like another person who works in the hospital, family, friends, a wealthy person with connections. So it's not just a famous person. So a VIP is kind of a broad term we use in the ER. And I wanted to point this clip out because a VIP is not just like, I think some people feel like if you're a VIP, you get better care. You're not getting better care. You're probably getting more care, and more care doesn't necessarily mean it's good. It's good for you. Sometimes it can lead to like a lot of unnecessary testing, imaging, and even procedures because you have this like fear of like not wanting to miss anything on this VIP. Also, taking care of VIPs can sometimes be very uncomfortable depending on the patients. Like I've experienced people that are great, like just normal patient interactions, but sometimes it can be uncomfortable. It can kind of lead you to do things you may be not comfortable with, some things you may not want to do. It can kind of put you in a position too, because like you have a VIP, and depending on who they are, you might not want to get a bad review from this person, you know. And again, you also, number one, you don't want to miss anything, you know, especially if someone famous, hospital admin, you miss something that seems pretty bad on you. You don't want to miss anything with any patient, though, at all. I'm going to say that, too, as well, though. But, you know, it can be pretty uncomfortable taking care of these people. And so you kind of go from, like, this practicing medicine to almost, like, managing someone's perception of how it should be. And, again, it's just like, the way I look at VIPs is like I kind of try to treat them how I would treat any other patient because I've had experience before where I think I was a young guy. I was doing locum somewhere. He was a young guy. He's like a city councilman in the city. Guy's in his 20s, and he had like, you know, a little bit of facial like numbness. It probably was Bell's palsy, but he was still moving his forehead, so they couldn't confirm. This guy went through like a litany of tests, and he was in the ER all day. He was a really nice guy. He ordered the staff's food and everything, but had his own room and stuff like that. And it's kind of what, you know, being a VIP leads to those things. And again, I just want to iterate, like, being a VIP doesn't mean you get better care. You just get like, you know, you might get a room faster. You might get more frequent checkups though, but you know, you also may get more tests. But again, that's probably not going to always be the best thing for you. Like I don't know if you guys, you know, especially being RT, I'm pretty sure you probably had to deal with some VIPs as well. You, Durrani, I don't know how you guys feel about those.
I think similar to what you guys talk about, I think the only patients like that we deal with, like hospital administrators, all they get is like an asterisk on their account. There's like FYI, this is a manager or a CEO, family member or whatever. And we're just like, okay, but we're not going to do anything different. I think mostly it's coworkers. Like when a fellow nurse brings her kid in, and because they have group, and I'm responding, and inevitably, if it's a nurse's kid, they're gonna have the worst case ever that I've seen in months, and you're trying to like present that overall appearance of it's no big deal, like this is gonna be fine, but meanwhile you're like, oh my gosh, like of course this is happening, or like responding to a delivery for a fellow RT or the physician that you worked with, and now all of a sudden you are in the room when their infant is coming out. And I think those are the moments that I feel it more of, like just a little bit of that concern that this is one of our own kind of thing. I don't know. I didn't really. I understand for the public, they probably aren't familiar with that, but it's kind of one of the perks of working in healthcare to be able to maybe access a little bit of a quicker. We don't have many perks, but that's one of them, of being able to maybe get in and seen if you need to.